Tracy.
And I'm Saad.
And our video will be about
Polycythemia Vera. The discovery of Polycythemia Vera returns to 1938, when it was described as a part of the spectrum of myeloproliferative disorders. Because of the widely varying opinions regarding diagnosis and treatment options proposed for primary polycythemia, an international Polycythemia Vera study group was found in 1967, with the goal of providing a unifying diagnostic algorithm and treatment regimen for Polycythemia Vera, or primary polycythemia.
Polycythemia vera is a blood disorder in which your bone marrow makes too many red blood cells. Polycythemia vera also may result in production of too many of other types of blood cells, white blood cells and platelets. But it's the excess of red blood cells that thicken your blood and cause most of the concerns associated with polycythemia vera. Polycythemia vera, also called primary polycythemia, is rare and usually develops slowly. You have it for years without noticing signs or symptoms. Often, polycythemia vera is found during a blood test done for some other reason.
The causes of polycythemia vera is still unknown. However, there are some possible causes. Most patients who have PV have a mutation called JAK2V617F that located in the JAK2 gene within their blood-forming cells. This mutation is one way that JAK pathway signaling can become dysregulated and cause diseases. The end result is that the body makes big numbers of blood cells. PV is an acquired mutation in a subset or a clone of normal bone marrow cells called stem cells, leading to excessive production of blood cells. These stem cells may be abnormally sensitive to growth factors involved in blood cells production. One theory suggested a link to radiation exposure.
Men may be slightly more affected than women to develop this condition. People older than 60 are most likely to develop the condition, although it may occur at any age. Polycythemia vera occurs in all age groups, although the incidence does increase with age. One study found the median age of diagnosis to be 60 years old.
The symptoms that polycythemia vera patients may have are headache, dizziness, itchiness, especially after following a warm bath or shower, redness of patient's skin, shortness of breathing difficulty when patients lie down, numbness, tingling, burning or weakness in the patient's hands, feet, arms, or legs, feeling of fullness in the patient's upper left abdomen due to enlarged spleen, and fatigue.
Blood clots due to the thickening of the blood and because of decreased blood flow. PV can also have platelet abnormalities leading to clotting. Clotting can cause a stroke, heart attack, or blockage of an artery in your lungs, pulmonary embolism, or in a vein deep within the muscle, deep vein thrombosis. Some persons with PV develop splenomegaly, enlargement of the spleen, due to overworking of the spleen from the high number of blood cells being filtered throughout. The high level of red blood cells can lead to other complications, such as open sores on the inside lining of your stomach, upper small intestines or esophagus, peptic ulcers, and inflammation of your joints, gout.
To diagnose PV, doctors will need to do a blood test, which is the most frequently used test. The result would be positive for PV if an increase in number of red blood cells, and in some cases an increase in platelets or white blood cells. elevated hematocrit measurement, the percentage of the red blood cells that make up total blood volume. Elevated level of hemoglobin, the iron-rich protein in red blood cells that carries oxygen. Very low levels of erythropoietin, a hormone that stimulates bone marrow to produce new red blood cells. Also, there are other tests doctors may ask for, like 1. Bone marrow aspiration or biopsy. In biopsy, doctors will take a sample from a solid portion of the bone marrow, while in aspiration, doctors will take a sample from liquid portion of the bone marrow. 2. Tests for gene mutation. As we mentioned before, possible reason could be a gene mutation. Gene tests may show the mutation in the cells that associated with PV.
Phlebotomy, also known as bloodletting, is one form of treatment. The removal of blood from the body reduces the blood volume and brings down the hematocrit levels. It also reduces the risk of blood clots. Venesection is typically performed in people with Polycythemia Vera to bring their hematocrit, red blood cell percentage, down below 45 for men or 42 for women. It has been observed that phlebotomy also improves cognitive impairment. Low-dose aspirin, 75 to 81 milligrams daily, is often prescribed. Research has shown that aspirin reduces the risk for various thrombotic complications. In more severe cases, Coumadin may be used to reduce the risk of blood clotting. In cases if the patient has severe itching of the skin, or when there is significant thrombocytosis or blood clotting, chemotherapy may be used as a solution. While it may seem like bone marrow transplant would be a solution, it is rarely undertaken in Polycythemia Vera, since this condition is non-fatal if treated and monitored. The benefits rarely outweigh the risks involved with such a procedure.
Hello.
Hi.
Here we have Ronald Simon, and he's going to tell us a little bit about Polycythemia Vera. Mr. Simon, when were you diagnosed with Polycythemia Vera?
I believe it's long about mid-40, about 45 possibly.
Okay. What symptoms were you experiencing?
Well, I had severe pain in my left chest at the time, but I thought it was, what I thought it was maybe I had ruptured my spleen.
Okay.
From moving some very heavy stones by myself with leverage and so on.
Okay.
And after going to the doctor and examined me and took my blood count or gave me a blood test, he came up with a sheet of paper. He showed it to me, and it had 2 columns of different medical terms. And he admitted that he did not know what was the matter with me, but he would take me to a place where they could find out. They was capable of finding out. My blood count was 21.3, and their measures, values at that time were, I think, between 12 and 18.
Mm-hmm. This was your hemoglobin.
And my hemoglobin was really high. I didn't realize it, but I had no pain afterwards, but I didn't realize when we were waiting in the hospital, my feet were blood red, my hands were red, my eyes were bloodshot, and I was working on the railroad, and different people approached me and asked me about why my eyes were so bloodshot. It looked like I had been on about a week or 3-day or 4-day binge, but they were just red, and the doctor had no reasoning or no excuse why. He could not tell me. So he sent me to the Grant Hospital in Columbus, and there they run several tests, and after about 5 days, there was 2 learner doctors come in there. One of them was a foreigner, and I got acquainted with them, and they told me they wanted to try something, so they took a 30cc syringe, and they got 30 cc's of blood out of my system, and then they told me they was going to mix that with radioactive chromium 33, they called it, and mix it all together, and then put it back into the bloodstream and let it circulate for so many hours. Then they withdrew the same amount and ran a test on it, and it proved out to be their theory that it was polycythemia.
What's polycythemia?
My doctor was named Jerry Guy. He was a very good man and a very well-learned man. And he treated me for actually 2 weeks. But after the 5th day, then they started to reduce my blood volume. At that time, and maybe yet today, I think that's the only medical way that they handle it. Polycythemia is reduce your volume.
Yep.
And in the 10 days that I remained in the hospital, they took a phlebotomy every other day. So I'm saying they give me 5 phlebotomies in 10 days. Don't sound reasonable, but in my case it did. You might say I was 2 or 3 pints over full or something like that. But when they first started to do the phlebotomy that is, they started with a syringe. They started the normal way, but with no response. Then they took a 30 cc syringe and tried to, I watched all this, and they tried to pull it out of the vein in the mid-arm and inside the elbow, and without very much success. It would come out very thick, very thick. I would cut myself shaving or cut myself anyway. I did that before I left the house, and I wouldn't bleed. I thought that was kind of strange, but
So now that thinking back, that was another symptom of yours.
Yeah, it was another symptom.
Never thought of
And
it. Like that.
yeah, true. And they did this for a couple of times before the blood ever started. Finally, it started. I was taking medication at the time, but I don't know about the Coumadin at this time. But it started coming a little freer. Then maybe they got like 150 or half the amount they wanted, like a couple hundred cc's or 150 cc's. And I remember one time there was a young nurse come in, or she might have been not a resident nurse, but maybe a practicing, whatever, student. She might have been a student, the Oriental persuasion, and she didn't do the phlebotomy like most of the IV nurses did, you know, into the vein here and mid-arm. She went in the back of my hand, and I thought that was very unusual. And she actually bent 2 16-size needles, and I could see what she was doing. She was ramming those needles into the tendons on the back of her, not the blood vessel, but into the tendons. And it really did hurt. And I called the IV nurse, and I told her, this woman's not going to do this to me anymore. If you'll get me an IV nurse, I'll sort of allow her to do her work.
Yeah.
And they did. And the lady started crying. She said, I don't want to hurt nobody, but she left the room, and she didn't come back until after the operation was settled. But then the blood started flowing a little better. And after each phlebotomy, they'd give me 3 blood pressures. One sitting, one laying, I'd usually be laying, and then one sitting, and then one standing. And after a total of 15 days, they finally released me. And I'd go back, for a while I'd go back every 30 days. That got really monotonous. Drive 200 miles and maybe have to wait 3 hours. And finally I got recommended, my doctor, Guy, he quit practicing medicine and started teaching. And he recommended that I come down here and see Dr. Yoshida, which I've been with ever since.
Locally, yeah.
Local, right.
Okay.
And it was a matter of half hour, 45 minutes instead of 4 or 5 hours.
That's a lot better.
Much better.
So after being diagnosed there, being treated those first 15 days, after you got the polycythemia under control, your regular lifestyle changes. You had to go every 30 days to the doctor?
Well, I did do that, but I was in no pain, and being locally here at the house, at home, and going to a doctor here, it was really no piece of cake, really. It was about 30, 40 minutes of my time once a month.
Yeah, you had to change your diet any, or?
I was just told not to eat food rich in iron, like liver, greens, spinach, things like that. And that was about the only thing my diet was restricted in my diet.
Make sure you take your medications.
Right, and
get your blood
I would
work
also, each time I would go in, they'd give me a pro time, a PT, and I would be, let's see, after I did that, they kept me on the medicine, and then they may have to change if my pro time got out of perspective. Then they might have to give me more or less Coumadin.
Right.
That control, they based their controlling on the Coumadin by the pro time. So about 4 or 5 years ago, I was about the last phlebotomy I had, and I really started to lean towards being anemic. My hemoglobin dropped down below 12, got down about, I think about 11. And I went to another doctor. My doctor recommended me to go to Dr. Wolf, I believe it was. And they was treating me for anemia. So
That would be approximately 30 years of having
at least.
polycythemia vera
Right.
led you to anemia.
And even my doctor, very guy at Columbus, before I came down here, he said that maybe we'd go a couple of months without a phlebotomy. Ordinarily it'd be once every month. He'd order me a phlebotomy. And he said, I think the Vera has burned itself out. But it would continue. I could continue to have a phlebotomy. And down here it started stretching out a little bit. And getting maybe more or less ahead of my story, I asked my doctor what caused this. And he said they wasn't exactly sure, but most cases they've had, that the patient has worked in a confined area, like in a coal mine, or maybe a mine where there's a lot of dust, or a dusty area of any kind, they thought was somewhat a cause for the polycythemia. And then later on I got to thinking, working in a coal classification yard, then I did a lot of woodwork in my basement of my home. And it wasn't too well ventilated. And I breathed a lot of fine dust. I know I did, a lot of fine dust. And I asked him if that could be the cause of my polycythemia, and he agreed that it could possibly be. So after I retired then, I've been retired now for 25 years, after a while I got away from that. In the shop I got me a ventilation system, right, dust collector. And I no longer worked in the coal yard, so my living habits were changed. Better conditions, cleaner air and all. And now for 4 or 5 years I haven't had a phlebotomy. But then I told you, at first, they tagged me as being anemic. And we discussed it. Dr. Wong and I discussed it, and he first mentioned it. He said maybe if we talk to Dr. Inoshita and reduce your Coumadin or cut it to 0, we could see what would happen. Watch it closely and see what happened. So we did. I quit taking the Coumadin, and lo and behold, in about 30 days, my hemoglobin started to raise. And I think in about 60 days, it raised up above the low level, which would be about 13 or 12. 13.8 is about what it is now. And it stays that way. Pretty much I go in every 60 days. And my hemoglobin's been that way now for possibly 6 months. And I don't take any Coumadin anymore. No proton, no need for proton. And Dr. Inoshita just gives me a regular checkup blood test.
Really
He reads the results, and we agree it's sounding pretty good.
Yeah.
And no symptoms, no pain, no swelling, no complications of any kind.
Very interesting.
And I feel fine.
Yep. So, if you had any advice to give anyone experiencing the symptoms of polycythemia, or newly diagnosed with such a disease, or what kind of advice would you give to somebody in that situation?
Well, I would say if they consider their workplace where they might work, if that could have something to do with it. Like the doctor said, in most cases, and most patients has been accustomed to working in a place like that. And that's why he asked me the same. And that could be one thing. And of course, if you got it, you don't want to eat vegetables rich in iron or anything, take anything rich in iron to make more blood, is take care of yourself.
Take care of yourself. Follow doctor's orders.
Yeah, right.
Definitely.
Right.
Now, would you give Shawnee State University and the makers of this film permission to use the interview?
Oh, sure.
Okay, for educational purposes?
Yeah, if it
and
would help someone else, I certainly would.
okay. And can we have permission to put this video on YouTube? YouTube.com?
On,
The internet?
sure.
Okay. Thank you very much for doing this interview,
Thank you.
and
Thank you.
we appreciate it very much.